Hey everyone, let's talk about Ghana's largest healthcare infrastructure. It's called Agenda 111 and it aims to completely transform healthcare access for Ghana's 38 million citizens. I find this project rather fascinating and I want to analyze its vision and progress and challenge. First, let's understand why Ghana launched Agenda 111 in 2021. At the time, the country had made strides expanding healthcare, but COVID-19 crisis exposed major remaining gaps in quality and affordable access. Many regions had no hospitals at all, or facilities were outdated and overwhelmed. This forced a lot of COVID patients to travel long distances for care or simply go without it. In response, Ghana's president announced the Agenda 111 plan to construct 101 district hospitals, 6 regional hospitals, 2 specialized psychiatric facilities, and 1 regional hospital, with the upgrade of 1 extra regional hospital. Altogether, that's 111 health facility projects. It was given an 18-month timeline to show the urgency and ambition of the project. On paper, Agenda 111 addresses glaring needs. New hospitals bring specialized services closer to the rural areas and urban poor, and this saves lives when time and money matter. I'm impressed by the range of care to be provided. Each hospital is going to have an outpatient department, imaging lab, dentals, laboratory, and more, and this elevates the underprivileged communities. Of course, the scale and the speed also come with risks. Building so many medical facilities so quickly is unprecedented for Ghana, so mistakes are bound to happen. Past mega projects face overruns and abandonment, like the one district one factory project that I just covered in my last video. I'll link it in the description for you. Now back to Agenda 111. Experts argued that the timeline was unrealistic given land, human resource, and oversight challenges were predominant. But the president saw it to be too important to delay, so funding was arranged through Ghana's government budget plus development partners like the African Development Bank. 2 years after it was announced, what was the verdict? I'll analyze the latest news based on the updates from Ghana's Information Minister this past August. He announced that construction was underway on 88 out of the 111 hospitals so far. Definitely a milestone, even if targets have slipped. Work is furthest along 54 sites with over 50% completion rate, but delays emerged securing suitable lands around some districts. A few sites saw work stoppages or slow contractor performances as well. In response, the government terminated some of the laggard contracts to move things along. While the majority of the hospitals are progressing, Ghana is certainly behind initial schedules. Contractor performance comes down to capacity gaps and oversight. These bottlenecks frequently hinder a lot of African mega projects, both public and private. But analysts should remain even-handed. Building so many hospitals simultaneously was a tall order from the outset, like with the 1D1F project. Again, link to that video in the description. On the positive side, the bulk of the hospitals are now under construction and progressing. The project remains very much in motion and not abandoned. The government also demonstrated accountability by terminating non-performing contracts. This upholds standards despite political pressures. Looking forward, the fact that the current president's term is coming to an end means that they have to intensify their efforts to complete these projects. All stakeholders must work urgently to minimize further delays. How Ghana would navigate this dilemma will determine Agenda 111's impact. Does the country need 100 plus subpar hospitals or 50 truly excellent ones? My hope is that Ghana views Agenda 111 as a long-term policy, not just a political milestone. When lives are at stake, decisions must transcend short-term thinking. Still, the project represents an important effort to expand healthcare to all Ghanaians. The setbacks don't negate the worthy vision and progress made. Let me know your thoughts in the comments, especially if you are Ghanaian. What should the government prioritize moving forward? Is it speed or availability in terms of mega projects like this? I'm eager to learn some local perspectives on the ground. Thank you for watching.